Hey everybody, Erin Knight here of Engineering Radiance, here with a special guest, Dr. Adam Harcourt, who is a functional neurologist specializing in helping people with migraines. So it's really cool that he's on with us today as a guest. Welcome.
Thank you.
And if you're listening live, then by all means, um, you know, type in a question or anything like that, and we're happy to chat with you. I know a lot of people catch us as a replay, so if you do have questions, you can also leave them as a comment to the video, and we'll try to follow up with you. But I invited Dr. Harcourt on today because he's got a new book coming out called Mastering Migraine. So this is something that everybody in this group is really going to want to get their hands on because you have a really different approach, I think, from conventional medicine, and really comprehensive approach. So I think that this is going to be really valuable information for anybody that follows me and kind of wants a drug-free approach and things like that is really, I think, going to resonate with how you do things too. So maybe first introduce yourself. And you have a clinic, and tell us what you do there.
Sure. Yeah. So we actually opened our practice in Santa Barbara, California, and we're still there. And we have another doctor that works there. And then we also have another location in Beverly Hills that we opened up actually a year ago, 2 days from now, I believe. So we have another location down there, and Dr. Perman's down there. And so I actually kind of almost accidentally got into treating migraine because when I first started, I had just written a paper on multiple sclerosis, a rare form of it, and we were doing a lot of TBI treatment. And in our area in Santa Barbara, there's just a lot of really good resources for traumatic brain injury, and there's some other good places for MS. And what I started getting recurrently was people that had migraines forever, and people that dealt with post-concussion syndrome. A lot of times they overlap and get confused, and then dizziness, and which kind of led us to vestibular migraine and things like that. And that's kind of how we started on it. And the interesting thing was I looked at it from the approach of migraine. If you look at imaging, for example, like 99% of imaging is perfectly normal. Okay. So unfortunately, we still kind of look at migraine as like this overt pathological disorder. Like you're just going to find a tumor one day and that's going to fix your migraines. And it's like, that's never the case almost. And so over the years, we've been able to dive in more and more to the research. And I was kind of figuring out like what I thought migraine was, the way that I was treating it. It just was different than what we thought it actually was. And so over the last few years, I find myself kind of repeating myself day in and day out to multiple people. And I was like, you know what, I'm just going to write a book and get all this out there so that, it's a little bit easier to digest. And so that's kind of how this came about. And I'm really excited to share it.
Okay, cool. What if somebody's, been through the gamut of practitioners and they've tried everything, what is different that they'll learn in this book?
Sure. So the main thing that they're going to learn is what migraine actually is, because the number one problem that I find with migraine treatment is across migraine sufferers and also practitioners is the fact that everybody has a different opinion on what migraine is. And it's like, well, how are we supposed to start treating appropriately if we all disagree on what's actually causing the pain to begin with, or the symptoms or whatever. And so that's where we start from. And my whole goal with the book is to get everybody on the same page. So if we can at least agree of what's going on, then we can figure out what the heck to do. So one thing that I kind of express here in the book is my bucket theory, where there's all these different things that can be really helpful for migraine, but each person has what I call their bucket, or the part of the brain that leads to migraine. And some people, that bucket fills up almost exclusively with nutritional stressors, right? And so they try a new diet, fixes their migraines, hallelujah, right? And then the next person tries the same diet and it doesn't do anything, right? It's not that the diet was a bad thing, it's just that wasn't the main thing filling up the bucket. And so what I find is, if you can do things to address the bucket, figure out where it is, and then stimulate it, right, make it stronger, and then also reduce the things that are filling up the bucket, that's how you see a regression of symptoms. I also see a misconception about migraine of like, curing it. And that's kind of a misnomer, because it is a chronic illness, which means it's genetically mediated, but it doesn't mean you have to have it all the time, right? And so I kind of introduced my concept of the migraine spectrum, which is where if you're prone to migraine, you're prone to migraine forever. It's just how it is. But you have people on the spectrum that on one end are having migraines all day, every day, And then on the other end of the spectrum, you have people that have them every decade or so. Both of those people are predispositioned, but obviously you want to be as far down on that end as you possibly can. And that's a lot of what we talk about in the book. How do you get to the other end of the spectrum? And part of what we did was we worked with an illustrator for months trying to take a lot of these concepts and make them a little bit more tangible. So in addition to trying to keep this short and succinct, we also have a lot of pictures in there. So it's an easy read, relatively speaking, for a medical book. But I did gear it more towards patients in the first half, and then a little bit more towards clinicians in the second half. But it's certainly not a textbook. It's definitely more, here's what's going on, here's how we can conceptualize it. So here's something you can do on your own to try to, make your bucket bigger or keep it from filling up.
Okay. Hi, everybody. Courtney says hi. Kim says hi. Kim is saying she's had Botox and tried a lot of meds, and nerve block was the only thing that helped. So I guess that happens a lot. Maybe somebody finds like one kind of Band-Aid, one treatment that kind of works, but that's not really getting to the root causes. How would you explain to somebody the difference of like actually finding like what actual root causes might be?
Well, and that actually can be tough because, for example, I give this example all the time is I have a lot of doctors that I teach that are in manual medicine, so physical therapists, chiropractors, acupuncturists, and all of them have tons and tons of stories of people that come in with, tingling and numbness in the arm or the leg, and they do their therapies and it goes away, right? Because it was more of a functional lesion. That's great. But if you have, say, a disc that's shoving on a nerve, you're going to have tingling and numbness no matter what. And there's really nothing you can do to fix that except surgically resecting it, right? So can a disc on a nerve cause the tingling and numbness? Sure, but there's a lot of other reasons for it to happen. So with migraine, is it usually a bone on a nerve or a disc on a nerve or a compression of a nerve that's causing the migraine? Not most of the time, but if it is and you fix it, it's going to do awesome things for you. And so part of what we talk about in the book is starting from I don't want to say holistic, but a standpoint that goes after the root cause, which is this genetic, what we call hyperexcitability. And if you can do all the things that should stabilize those parts of the brain and it's not working, then you may have a more overt problem. So you might have a nerve that needs to be decompressed, or you might need a medial branch block, or something that's a little more invasive. But obviously, with most of that stuff, you can't go back after you've done it. And so you want to find a practitioner that at least challenges the system. So for example, I have a pain management doctor in both Beverly Hills and Santa Barbara that they'll go in and shoot up some lidocaine or some sort of like nerve agent that if it works, great. They'll go in and ablate the nerve. People get really great results. But I've sent a lot of patients over there and they do their thing and it doesn't help. So it's not, if you go and do an ablation, it's not going to do anything, right? So my whole approach is do what makes sense and do it from a conservative to an invasive standpoint, which for some reason seems to be less common these days, which is the craziest thing to me. So, do some people benefit from Botox? Sure. But if you think about what it's actually doing, is it's decreasing the activity level into that trigeminal nucleus. And if you're trying to strengthen it and make that area healthier, well, Botox isn't going to do it, right? Because you're getting less activation. However, if your bucket's pretty small and you get Botox and you get less input, well, that bucket's not going to overflow because you don't have too much, afferent input going in there. And so it can be a good short-term thing, right? So I'm not for or against any therapy. I'm for understanding migraine and then treating it appropriately. Does that make sense?
Yeah, definitely. Courtney is asking, what's the best thing for pain? That's a pretty broad question.
So,
maybe you can talk to us about what is a functional neurology and like how that can help calm down the brain and kind of help with pain. Because I think that's something that a lot of people haven't heard of.
Yeah. So the basic idea of functional neurology is we do a full neurological exam on people, figure out what areas of the brain aren't working as well, and then we rehab them as best we can. It's kind of like PT for the brain is the best way to think of it. And it specifically works well for migraine because in migraine, most of the time, what you're finding is different areas of the brainstem on either side or the cortex that are genetically predispositioned to not be as healthy as they should be. And it has to do with ion channels. And the only way to move the inside of the neuron to a more negative standpoint is with stimulation or activation. The problem is, if you stimulate or activate an area that's not stable enough, it can also become hyperexcitable, lead to migraine. So I see a lot of times patients stay away from things that could actually be awesome for them, but they avoid it because it gave them a migraine sometime. It's so frustrating.
Like exercise or something like that?
Exactly, exactly. Because, some people say, well, I went for a 20-minute run and I got a migraine. I can't do that anymore. Well, maybe try a 10-minute run, or maybe try a 5-minute run, or maybe running's just too much. Maybe we try some isometrics, or you try some, body weight exercises or something else, because ultimately movement is going to be good for you. You just got to figure out what your threshold is. And one of the neat things that we're kind of pioneering is abortive migraine therapies that you can do that are non-invasive. So we do a lot of things with peripheral nerve stimulation, vagal nerve stimulation, what's called insufflation, which is developed by a colleague of mine, which is really cool. And they're coming out with some neat devices there. We're also pioneering some new methods with laser therapy. So we're seeing some really neat things with the lasers that we're using, not only to prevent migraine, but then also to get rid of it while you're having the migraine that day. And so we encourage all of our patients, hey, if you wake up with a migraine and you get one during the day, get into the office no matter what. We'll try to knock it down as best we can. And if we can't, take your meds, do what you got to do. But ultimately, if we can reduce the amount of pain that you're having without any drugs, and do some neuromodulation at the same time, hallelujah, right? That works really, really nicely.
Of course. When you're talking about vagus nerve stimulation, are you only talking about things that you can do in the office, or are you talking about like breathing exercises and things that people could reasonably do at home too? Because not everybody's even in California, much less your neighborhood to happen.
So obviously, vagal nerve stimulation is a wildly broad topic, right? You can do it from breathing, you can do it from visceral massage to singing. Anything is vagal nerve stimulation, right? What I'm specifically referring to is there's some peripheral nerve stimulation that you can do, some places on the ear or on parts of where the neck is, that you can do that stimulate the vagal nerve very, very heavily directly, right? As opposed to, doing something like breathing or whatever that's more, that's really good for vagal nerve, especially at home, but it's not the direct depolarization of those nerves. And that's, for some patients, it works really well, and we'll just send them home with a unit and teach them how to use it. And that works really great. The Gamma Core is actually kind of based around this idea, where they do stimulation to the cervical portion of the vagal nerve for a couple minutes on each side. That's, it's a medical device. They've been researching it a lot. It's got mixed results, but again, that's almost everything in migraine has mixed results, because it's such a wide,
different root causes.
Exactly. And again, that goes back to my point of figure out what area is dysfunctional. Then any of these things can be helpful. You just got to target them appropriately.
Okay, let's see. Kim also is asking if you have any tips for getting some sleep when you have a migraine.
Oh, yeah, that's tough. There's a couple different ways. We typically will do some hormonal testing. So sometimes we find that, their melatonin levels are too low, or their cortisol is too high, or their HPA axis is off. And so if you can fix that, that usually takes care of it. Now, if you're in the middle of a migraine, that can be challenging. So we'll typically try different compounds that help people get to sleep. So, magnesium is the most common one that people use. Almost everybody that's had a migraine knows about magnesium, but there's other compounds as well, like kava can be really calming. There's a product called Kava Forte we use a lot. It's kind of like a calming agent. It's really nice. There's what else? There's one called Nintran. It's a herbal remedy. I don't use it very often, just because we usually don't get to that point. Most of the time when we're doing therapies for migraine, we just wear people out and they pass out, and it's not a problem. But one thing I've been actually encouraging people to try if they're having a migraine is ginger, but not preventatively. So there was a good study that came out a couple years ago that about 400 or 500 milligrams of ginger, as soon as you start to feel, an aura or anything coming on, can be great. And 2-3 hours later, you can take another 400 or 500 milligrams, and it works really well, right? For some people. For other people, it doesn't do anything. But they just came out with a study like a month or two ago that said if you use it preventatively, so you use ginger every day, it doesn't actually help at all. So I have my patients use it more like an Advil or like a Triptan, where you only use it if you absolutely need to, not as a preventative.
Fair enough. Yeah, that's super helpful. And yeah, hopefully just knocking down that pain and inflammation would help you sleep better. Kim, thank you guys for the questions. It's fun to have you on.
These are great questions.
Tracy's asking the probably the most important question of all today. What is the book called? When
Oh.
is it out? And where can we get it?
So I have the only copy that actually is out. So it's Mastering Migraine, and it'll be out in about 2 or 3 weeks. And you can get it on our website. It's just adamharcourt.com, and I'm sure Erin has links or information to that. Yeah. But you can pre-order there. We're taking a little bit longer to get printed because it was over the holidays, so it's going to take a little longer. But I'm really excited about the book because we've been working on it for years at this point. And mainly what I'm excited about is the conversation it's going to start, because I still have doctors that swear to me that migraine is just blood vessels being too big, or it's just dehydration, or it's just like other headaches. And it's just not what the research supports. It's a completely different thing. And I really, the course that we teach on it actually through the Carrick Institute it takes the book and puts that into about a 150-hour course. So we dive into every study that's out there currently on migraine. But this really summarizes into the things that you need to know. And again, I believe that you can start to master migraine if you understand what the heck it is, right? Because if you don't, I see people throwing darts for 40 years hoping something works. And a lot of things people do are great, right? A lot of things that they do are really, really good. But again, if you don't understand what's actually going on and why multiple things together would be helpful, or the threshold and all that, it can be really, really frustrating. So again, my goal is just education and trying to get us on the same page.
Yeah, I love that you're aiming this towards the medical community as well, so that we're getting a bigger, like an updated conversation really about what migraines are. Because I talk about this too. It works. I see it works. This is how I work with people. Like, obviously, this is what we're doing. But then they're coming into me after seeing so many different doctors, and it's just like, here's a pill. Here's a pill.
Here's Botox. It's even funny. I've had a number of patients that will come to me after they've had 30 or 40 years of migraines, and they're finally getting relief and they're feeling better, and they'll tell their doctor, and they're like, what do you mean diet doesn't have anything to do with migraine? Or like, what do you mean you're doing this? It's like, it can be exhausting. So luckily a lot of doctors are starting to get up on this stuff, which is really, really great. But there's still a lot of people that see it as just another headache, and that's a huge mistake. But the cool thing is we actually talk about things like vestibular migraine, ocular migraine, hemiplegic migraine, because if you understand the pathology, it makes total sense that you would treat all of those things very similar, just targeting different parts of the brain, because again, it's all a hyperexcitability issue. So for example, one of my favorite things to treat ever is hemiplegic migraine, because it seems to be misunderstood, but every case that we've had has done really well, right? And it's not anything wildly complicated or confusing. It's actually relatively simple, but these people respond really, really well. But if they don't get this type of treatment, they suffer for long, long periods of time. So again, if I even developed for the course, I developed what I call my hemiplegic exercises, and just giving them to other doctors, it's going to save people a lot of time wasted, on lumbar punctures and on MRIs and CTs. It's awful.
Yeah. Well, thank you. I know writing a book is no small feat.
I thought it was, but it turns out it's not. So.
Yes. So thank you for all the time you put into putting this together, putting this resource for us. I hope you guys listening will check it out, and that we can continue to get the word out so more people can learn and get some answers finally. So thank you.
You're very welcome. Yeah, no, it's my pleasure, and I just can't wait for people to read it and see what they say and start some interesting conversations.
Okay, awesome. I'll put the link below here, and I'm sure we'll talk again soon. Thanks, guys. Thanks for listening.
Thanks, Erin.